Good afternoon, guys. Rob here from Nutridyne Europe with Dr. Robert Silverman. Lesson 6 today, cleaning up on the ketogenic diet. So a very brief introduction today. I've seen what Dr. Rob's got in store, so I'll pass you over to him and we'll get cracking.
Thanks so much, Rob. It's always a pleasure. Lesson 6, and just so everybody knows, Rob and I were brainstorming. We got a lot more for you, so we really appreciate all the support. We appreciate all the questions, and I just want to say, anybody who's on live, feel free to ask a question. I will stay on and answer any question that you have. And if you have questions later, send them in. You have all my info in the front, or you can send it to Rob. And let's really dig in. I've been using a ketogenic diet for several years now. Without question, a ketogenic diet is a conversation piece in all the different population bases. We all know that it was put together in the 1930s for epilepsy. So without question, if you have a neurodegenerative concern or a patient with a neurodegenerative concern, I would strongly recommend considering the ketogenic diet. In addition to that, the ketogenic diet is also one that a lot of patients like because people like to eat fat, and fat is a much better fuel source, and you'll learn about that. But the biggest thing is cleaning up on a ketogenic diet. I'll show you what the keto is, but for me, I only do the clean keto. So I'm going to go through a little bit on that so you guys have a good overview of what the clean versus the dirty keto is, because you will get that people said, I tried the keto, and this one, my cholesterol markers went up, which isn't the case. It didn't work for me. They didn't do the right keto. They didn't do the clean keto. So without question, the ketogenic diet has helped countless people who have struggled with managing their weight. It's a diet that's been split into two different diets, one that's been around for over 100 years. The other one is, if you will, a new spin for modern eating habits. How you decide whether eating clean versus dirty is right for you. Compared to most diets, clean keto not only is used to help people lose weight, recent studies have demonstrated that it hosts a variety of health benefits that don't necessarily include just weight loss. Clean keto can help increase energy levels, promote brain function, and support athletic performance for both professionals and amateurs alike. Those who have experienced the benefits of clean keto are understandably curious about the latest version of the diet, known as the dirty keto, and how it holds up against clean eating. So let's take a little quicker look before we get into it. The clean keto is based on the idea that eating a fixed macronutrient breakdown of mostly healthy fats, high protein in moderation, and restricted carbs, less than 50 grams per day, provide your body with the fuel you need to lose body fat without hunger, weakness, and fatigue. The reduction in carb intake puts your body into a metabolic state called nutritional ketosis. During this nutritional ketosis, your body no longer relies on glucose as the primary energy source. Instead, your liver converts fat into ketones, which are a great source of fuel for both your body and your brain. Ketones also increase something called BDNF, which works to support your brain's existing neurons while encouraging new neuron and synapse growth. On a clean keto diet, you'll get most of your calories from healthy fats in foods like avocados. I'm not going to say grass-fed butter. What I'll say is grass-fed, oh my goodness, cooked butter, where you get rid of the dairy particles, olives, olive oils, coconut oil, nuts, and seeds. Keep in mind that nuts and seeds are better than others. You want to choose those that are high in fats and low in carbs. Brazilian nuts, almonds, walnuts, chia seeds, and flax seeds are great options. You can also eat all the non-starchy leafy vegetables you want, as well as low-carb vegetables like broccoli, peppers, cauliflower, green beans, asparagus, cucumber, and zucchini. Moderation, you're looking at your grass-fed beefs, your pasteurized raised poultry, cage-free eggs, and wild-caught fish. Guys, if you really get that urge and you want something sweet, 90% chocolate is your best option. Now, let's talk a little bit about the dirty keto. Follows the same macronutrient breakdown of fats, protein, and carbs as clean, with one major difference. It doesn't matter which foods those macros come from, and that's a problem. That is to say, on a dirty keto, instead of choosing good fats, like a wild-caught salmon, appropriate clarified butter, avocado, you would eat a fast food burger without the bun, processed cheese, and pork rinds. Can you lose weight by following the dirty keto? Yeah, possibly, but the benefits halt there, and there are remarkable health drawbacks from dirty keto diet that you should be aware of. For starters, this dirty keto is missing vital macronutrients like vitamins, minerals, and enzymes that are necessary for overall health. Furthermore, processed foods are usually high in sodium, which can lead to bloating and inflammation. You're more likely to regain the weight you lost and experience more cravings and less satiety. Dirty keto foods can trigger these cravings, bloating, and feelings of withdrawal, which symptoms can always be associated with, if you will, the keto flu. So it always comes back to the same thing. Good, healthy foods are critical, and that's why they need to seek you out, you the practitioner, to put them on a keto diet and then ascertain which foods and, as you'll see, which supplements and when are going to allow them to optimize their outcomes. Don't blame the butter for what the bread did, and it should be the clarified butter. So here's a study of the keto in America versus standard American diet. All three groups, all patients had either metabolic syndrome, prediabetes, type 2 diabetes. Body fat percentage was above 30%. You had three different groups. Group 1 is going to be the big winner in that less than 30 grams of carbohydrates, no exercise, versus Group 2, normal diet, no exercise, and Group 3, normal diet with 30 minutes of exercise for 3 to 5 days. The result, very simple. The keto group had significant positive changes in weight, body fat, BMI, hemoglobin A1C, and ketones. All variables for keto group outperform those of exercise and non-exercise groups. So think of that. Get the ketogenic diet, good, clean keto, proper supplements and exercise, and you're going to have a health-performing diet. So the interest in the keto grows for weight loss and type 2 diabetes. Here was a study in JAMA of a meta-analysis of 13 randomized controlled trials. Those on the keto diets lose more weight and keep more off than low-fat diets. They actually reported decreased hunger because they had satiety because they were consuming nutrient-rich foods on the ketogenic diet. Metabolism slowed 40 calories on the low-fat, but had no decline on the low-carb. Once again, you're not going to need to eat as much when you're on a good quality keto. Fat has more satiety. Fat has more nutrients than a lot of these processed carbohydrates. So now let's take a look at this interesting slide. In that, you've already seen this idea before. So you have the basic ketogenic diet, which is rich in fat and low in carbs. It induces a decrease in blood sugar and insulin levels. A decrease in insulin levels lead to increased fat burning. Your liver uses the fatty acids to generate ketone bodies as fuel for the body and the brain. Ketones burn more effectively than sugar, and burning ketones for fuel create less reactive oxygen species than burning carbohydrates. So what is keto adapted? And this is a concept that everybody needs to know. If someone's keto adapted, they're going to benefit and make ketone bodies. Keto adaptation means that you've shifted your metabolism to relying on fat-based sources as your primary source of fuel. Your body increases fat burning and breaks down fats into ketones to be used as the primary source of energy. So look at keto adaptation and how it helps reverse metabolic syndrome. Obviously, all the reds are keto, the low fats are blue. Just a quick scan, you see straight up ketogenic diet is beating the low fat diet in all health markers. There isn't one that you see any difference in. So here you have an improvement in body mass, ab fat, triglycerides, HDL, etc., etc. So it's a great choice when you take a look at the keto adaptation for metabolic syndrome. I can't say that I use the keto all the time, but the keto is a consideration almost all the time. Keto adaptation reverses type 2 diabetes. Study in JMIR diabetes. A novel intervention, including individualized nutritional recommendations, reduces the key marker for diabetes or prediabetes, if you will, hemoglobin A1C. Now, again, a change in lifestyle and diet is beating or matching drugs like metformin. It's a huge takeaway for our practices because we want to offer alternative options. And when the alternative options are as good as a drug without the side effects, it really simply becomes a no-brainer for the patient which to choose. Nutritional ketosis for weight management and reversal of metabolic syndromes. Humans have the ability, they thrive on the ability to consider ketones for fuel. During the states of low dietary carbs, insulin levels remain low, ketogenesis takes place. These conditions promote the breakdown of excess fat stores, sparing of lean muscle, and improvement in insulin sensitivity. We're going to have a few slides on the idea, and this came out in July of 2020, the keto diet for obesity and diabetes. Let's take a good look at this, because those are going to be the two things that we see here on my side of the pond, no different on your side of the pond. Explore the efficacy of the keto diet and its effects with patients. We're looking at overweight or obese patients with or without diabetes type 2. The keto diet macro was shown to reduce insulin levels, redirect lipid metabolism, and have ketone utilization. Ketone bodies are excellent energy sources for the body, and most especially the brain. The review consisted of 14 randomized controlled trials, 734 people overweight or obese, 444 diabetic patients, 290 non-diabetic patients. Look at the primary lab assessment: fasting glucose, hemoglobin A1C, fasting insulin, total cholesterol markers, triglycerides, etc., C-reactive protein, and serum creatine. They also collected your body weight, your BMI, your waist circumference, and your blood pressure. The effects of the keto on glycemic control over 3 to 12 months, they had positive results which were more significant in patients with diabetes than those who were eating low-fat diets. It demonstrated this by a significant decrease in hemoglobin A1C, HOMA, another blood sugar marker, and for diabetic patients. Then they upped their ante and went to the keto diet for 4 to 12 months. This demonstrated weight reductions in both diabetic and non-diabetic patients. Lipid profiles improved in diabetic patients, increasing HDL, decreasing triglyceride levels. The bottom line was the ketogenic diet is an effective strategy for weight loss. The big problem, or the little hurdle, is transitioning can be tough. So the takeaway here is, and we will help support this, and I'll tell you which ones to take and which product to take. Exogenous ketones are a valuable adjunct. And the reason they're valuable is it makes it easier to get into ketosis. It makes it easier if you bounce in and out to stay in ketosis. All my patients use some salts, which we call keto burn, and or the MCT oil, and it works like a charm. Now, in addition to that, intermittent fasting is quite synergistic with the ketogenic diet. Ketogenic diet for high fat versus high fat with exercise. Clearly, keto reduced body weight and fat mass. It decreased serum insulin levels. It had a positive impact on nerve sensitivity, and it actually increased epidermal axonal density. So for those chiropractors who are listening, ketogenic diet had a positive effect on peripheral neuropathy. And I'm theorizing it is that we know that blood sugar and sugar intake is very damaging to nerve endings. The conclusion was ketogenic diet can prevent certain complications of prediabetes and provide significant benefits to peripheral axons and sensory dysfunction. Keto diet, another study. And when people say it hasn't been studied, we're 15 minutes into this webinar, and all I've done is shown you studies from nutrition and medical journals on the ketogenic diet. Keto diet has shown a reduction in BMI and fat mass and visceral fat mass, the most inflammatory fat there is. Getting rid of that visceral fat, I can tell you I found strongly attributed to reducing your sugar intake. Keto diet, none better to reduce sugar intake. Keto diet also decreased food and alcohol cravings, increase in physical activities, reduction of sleep abnormalities, and there were improvements in sexual functioning. This is one of my bigger takeaways, in that I was on a panel and I happened to be the only male, a lot of female well-known docs, and they were truly complaining about their female base having trouble with the ketogenic diet. And I was a little skeptical of what they were saying. Well, my skepticisms were wrong, without question. this study really showed it, and then I implemented some changes in my practice. I'd love to share this with you right now. Male and female mice. It started with mice, keto diet, standard diet. After 15 weeks, males on a keto maintained blood glucose control, lost body weight. Females gained weight, poor blood sugar. The difference was estrogen. Once they removed the estrogen from the female's diet or decreased it and allowed it to detox normally, and you got, there's your hint, there was a decrease in body fat, maintaining blood glucose control. So what I found was women 15 to 50, if we took care of their exogenous estrogen, they benefited from the ketogenic diet. So my suggestion, and here's your first protocol and a big one, if you're going to have a female with the ketogenic diet, my suggestion is to detox their estrogen pathways. So what I use and have used in my office is hormone balance. It supports estrogen balance. It supports healthy endocrine function. It supports mood and well-being. A lot of macronutrient requirements. It has all the needed additional female nutrients. And basically, the dynamic hormone balance is essentially a comprehensive blend of evidence-based ingredients that support healthy estrogen balance and endocrine function. It's a naturally flavored formula that provides key herbal extracts, bioactive macronutrients, ligands, isoflavonoids, and antioxidants, which have been shown in clinical settings to help balance healthy estrogen levels. Poor estrogen balance is key for supporting, I said poor. It's actually proper estrogen balance is key for supporting healthy mood, well-being, energy levels, and a multitude of other functions. As such, when estrogen is too low or too high, a variety of health issues can manifest. When estrogen is too high, it's very hard for the to make ketone bodies. So what I would do to support the full detox protocol or detox pathways would be something called Chill X. I call it Chill X. It's not. It's Chill X. It supports cardiovascular function. It's a great support for cellular integrity, and it supports healthy inflammatory response. My suggestion is to mix the two together, and you're going to get this outstanding outcome with women in the ketogenic diet. You know, we've talked about the ketogenic diet, but I really haven't made the breakdown. It's very simple. Ketogenic diet is 70 to 75% fat, 20% protein, about 5% carbohydrates. Your body should switch from using glucose to fats as an energy source. Keto diet, a summary: limited carbs to less than 50 grams per day. Glucose reserves become exhausted. They can provide normal fat oxidation. Central nervous system requires another fuel source producing acetyl-CoA. Essentially, beta-hydroxybutyrate and acetate. Beta-hydroxybutyrate is the gold medal winner for a ketogenic diet in that it makes that an elite ketone body. Ketogenesis occurs in the mitochondria of the liver. Ketone bodies are an excellent source of fuel. Body's physiology is designed for fatty acids. Bottom line is that fat is 2.25 times more energetic than carbs, and the fat and the beta-hydroxybutyrate produce more ATP, the powerhouse of the cell in the mitochondria. So the ketogenic diet has a positive effect on the mitochondria. What are ketone bodies and how are they produced? Fatty acids, beta-hydroxybutyrate, acetoacetate, and acetone. Beta-hydroxybutyrate is the main ketone body that circulates in the blood. Acetoacetate, main ketone body produced by the liver. And acetone is the volatile ketone. It gives when you breathe out, a very sweet ketone breath. It's kind of like, smells like alcohol. But beta-hydroxybutyrate is the big takeaway once again. In addition to acting as an energy molecule, beta-hydroxybutyrate has a variety of cell signaling functions. It can actually help modulate epigenetic mechanisms. It has positive effects on cellular protection and reduction in oxidative stress. And these regulatory functions serve to link the outside environment to cellular function and gene expression. highlighting its implication for pathogenesis in the treatment of metabolic diseases. Let's look at the health benefits of the ketogenic diet. Without question, strong evidence for cardiovascular parameters, diabetes, weight reduction, epilepsy. I would personally put in neurological diseases without question in there. Some of the other ones where there's emerging evidence, PCOS with blood sugar, acne, and cancer. So how the ketogenic diet derives its health benefits. It's increasing and uncoupling protein. An uncoupling protein is a mitochondria intermembrane protein that a regulated proton transport channel or transporter. It's opening up your ability to enter the mitochondria. So therefore reducing the amount of oxygen species produced in the mitochondria. Increasing the mitochondrial number, as we talked about, helps ATP levels. The number one mitochondrial organ in the body, brain. Then you have heart and you have muscles. So obviously it's enriching needed organs for performance. It actually stabilizes the ketogenic diet, blood sugar levels, and reduces cellular dependency on glucose. You're now going to burn on fat. Remember we talked about dirty versus clean? Fat, good fat, is a clean fuel. Carbs are essentially a dirty fuel. And last, decreases oxygen species upon exposure to stress. Increasing the mitochondrial glutathione levels. Ketogenic diet increases the master antioxidant, glutathione, also activating the NRF2 pathway, which is the key antioxidant pathway in the body. It stimulates autophagy, your cellular cleanup. Autophagy won a 2016 Nobel Prize. It's a breakdown of cells. They use the cellular debris as energy to make new enriched cells. So you can get immunorejuvenation through autophagy. It's a much more efficient fuel source fat. We said it before. And it's also shown to be anti-inflammatory, and it inhibits some key inflammatory pathways like NF-kappa B. And it does so on the NF-kappa B because it blocks one of the signals in the NLRP3 inflammasome. It also decreased TNF alpha and COX-2 pathways. Let's take a look at the pathways that are improved by ketosis and also the pathways improved with intermittent fasting and time-restricted eating. So double down on insulin levels decreasing with the ketogenic diet. You're also matching that with caloric restriction. If you just look at the ketogenic diet and you see all the positive turning on and turning off, it's truly a cellular stimulator and it truly turns pathways on and off. So for me, as a functional nutrition, functional medicine practitioner, when I can get nutrients or foods that can turn pathways on and off in their cellular signal, I know I'm working at a very high level of helping the body get optimized towards their end result, which is better health and performance. When you mix this with intermittent fasting, you really see the ketogenic diet is a true synergistic approach with intermittent fasting. Wow, I mean, maybe we should be spreading this with our patients about helping taming flu virus. So Science Immunology, November 2019, the ketogenic diet activates a subset of T cells in the lungs. Ketogenic diet triggered release of gamma delta T cells, immune system cells that produce mucus in the cell lining of lungs. Ketone bodies fuel immune system. Now let's get to some ideas about the ketogenic diet's impact on athletic performance. The principles of a well-formulated ketogenic diet. Remember, we're restricting our carbs. We really want to restrict our carbs below 50 grams. If we can get it below 25, even better. It's a moderate, not high amount of protein, 15 to 20% of energy expenditure. Sodium, potassium, magnesium, zinc are critical to well-being and function. You're looking at those electrolytes. Those electrolytes are going to be critical to avoid what we call the keto flu. We'll go into more detail. Right there, sodium, potassium, magnesium, and zinc. I didn't, but you could clearly add electrolytes. Adding electrolytes are a critical element to overall support for the ketogenic diet and also avoidance of the keto flu. Weight maintenance ketogenic diet is necessarily high fat. Not all dietary fats are equal. So short chain saturated fats, monounsaturated fats are typically the choices. Remember, we can now embrace eating some saturated fats rather than avoid them. That literature is now dated. Dietary cholesterol is not a risk factor, and satiety, as I said before, is a robust indicator that we have needed energy in the body, nutrient energy. So we don't have to go in we don't have to go in wild details. To take away the title is everything that you need. Despite being higher in saturated fat, a ketogenic diet decreases circulating levels of saturated fat. That's it. Bottom line, even though you're eating it, doesn't mean that you're having higher cholesterol levels. The problem with the keto diet was that they were eating the dirty keto and not the clean keto. So how do you test? Essentially, testing to monitor, there's urine, there's blood, there's breath. The blood test is the most common. A lot of false negatives with ketones are normally produced by the liver as fatty acid metabolism. In normal states, these ketones will be completely metabolized, so very few, if any, appear in the urine. If the body cannot get enough glucose for energy, it'll switch to using body fats, resulting in increase in ketone production, making them detectable in the urine. Urine's very accurate. It's just everybody doesn't want to pee on a stick all day long. So the blood, if you want to get your ketones tested, are going to be the most viable suggestions for your patient base. And keto adaptation occurs after a couple of weeks, typically from day 3 and on. You want to be in ketones between 1.5 and 3. Keto adaptation enhances endurance, performance, and body composition in athletes. It's shown to improve endurance capacity, improve fat mobilization and oxidation, glycogen deposits are maintained, and improve aerobic and anaerobic exercise capacity, as well as body composition. So when you look at this, the MCTs, which we're going to recommend for consumption for stabilization of ketone levels, I'm a big proponent of medium chain triglycerides. Bottom line is medium chain fatty acids cross the inner mitochondrial membrane where other types of fat must enter in regulated manner. More absorption, inner mitochondrial space actually gets ketone body formation faster. You want C8 and C10. They actually metabolize more efficiently in the ketone energy. That's what we use in our MCT oil. We've taken out C12, lauric acid, tremendous health benefits. Antimicrobial, antibacterial. Get it in regular coconuts. It's a very slow form of energy. You're not going to get into ketosis actually eating lauric acid. That's why you need the extraction of the MCT oil. So here we have the effects of medium chain triglycerides on weight loss, body composition, satiety, and cognition. Here are the highlights. There's a greater reduction in body weight and more favorable changes in body composition in both healthy and overweight individuals. Medium chain triglyceride supplementation actually increased energy expenditure and lipid oxidation compared with long chain triglycerides. Supplementation with medium chain triglycerides increased satiety at the next meal and reduced food intake compared to long chain. Ketones derived from medium chain triglycerides improve cognition in diabetic and Alzheimer's patients and attenuates neurodegeneration in mouse models of ALS, MS, and AD. So let's look at the majority of clinical studies that have been performed with a mixture of C8 and C10. The bottom line is that the outcomes are stellar. You're getting increased circulating ketones with the addition of MCT oil. You're getting improved weight loss and body composition and increased satiety. You're getting enhanced cognitive performance. Ketogenic diet increases longevity. It also induces mental clarity. It improves cognition, and it also improves mood. So let's take a look. Nutritional ketosis causes natriuresis. Just let me hit all these and bring it in. So once again, nutritional ketosis causes natriuresis, which needs to be compensated by 2 to 3 grams per day of sodium. Symptoms of the volume depletion are headaches, dizziness, fatigue, and constipation. Sodium supplementation needs to be continued as long as nutritional ketosis. Nobody's saying you add sodium to avoid the flu. No one's saying to douse everything with sodium as you're through the ketogenic diet. However, ketone salts are a great choice. Why the salts? Because when you go from a fat-based diet, from a carbohydrate-based diet, carbohydrates have water. When you go to fat, you lose water. and it swooshes with all those electrolytes. You lose those electrolytes, you get a flu. So part of the salt, ketone salts in the keto burn is the fact that it has electrolytes and beta hydroxybutyrate. So you're getting into ketosis because the beta hydroxybutyrate, you're getting over the flu with the NaCl. So electrolytes are a critical element during the process of ketogenic diet implementation. So which fuel tank do you want to exercise? Well, there's limited energy stored as glycogen, liver and muscle of carbohydrates. Keto adaptation promotes access to fat deposits from anywhere to 40,000 to 150,000 calories, which is more energy rich, hitting the fat or hitting the glycogen in the stored carbs? The answer is obvious. So when you look at athletes, so recent ultra endurance records by low carbohydrate athletes, here we have 8 years ago, Tim Olson winning the Western States 100, Zach Bitter, Mike Morton. Great news for low carb, high fat diets. First and second place riders in the Tour de France and low carb advocates. Understand that these guys competed and won the Tour de France. They were not winners prior to the conversion to the ketogenic diet. When many of the other cyclists who they beat, which they hadn't beaten before, were still using carb and carbing up methods. Here's the idea of debunking the high carbohydrate dogma. The one book that I like the most is The Art and Science of Low Carbohydrate Performance. Volek, he's a great choice, does an excellent job. Here we have the All Blacks rugby team, and we also have some soccer teams. And basically what you're seeing is that a lot of endurance and power sports are starting to convert to the ketogenic diet. Here's what we call a FASTER study, fat adapted substrate oxidation in trained elite runners. You saw, again, Volek is the lead author. He talked about metabolic characteristics of keto adapted ultra endurance runners. Let's take a deeper look into the ketogenic adapted diets. So when you look at the high carbohydrate diet and the low carbohydrate diet, you're seeing a drastic difference. Listen, both these athletes look good, but when you compare the low to the high, what you're seeing is an increase in quality body mass, a decrease in body fat, obviously meaning there's less fat mass at a higher weight, less body composition, and guess what? Better VO2 max. So without question, in elite trained athletes, when you get them to be keto adapted, they're going to perform better, they're going to have more muscle, and they're going to have less fat. So here's some potential mechanisms to improve in repeated high intensity exercise after long-term adaptation to low carb, high diet, or high fat diets. Let's look at this low carb, high fat diet. Let's look at the left side. Decreased body weight, decreased body fat. They said ambivalence to lean body mass. Some of the literature I've seen increase in lean body mass. You also have increased fat oxidation, carbohydrate oxidation, decrease in glycogen utilization, upregulation of fats. Ultimately, the takeaway here is increased ultra endurance performance and increased repeated high intensity performance. The takeaway is very simple. Ketogenic diet is good for endurance and power athletes. So the effects of the ketogenic diet on body composition, strength, power, and hormonal profiles in resistance training males. So once again, our wonderful Western standard diet, your guy's diet isn't as bad, but it isn't that good yet either. We're all in the developed Western type of countries just eating too much processed food. So ketogenic diet was studied with 25 college-age men. They did it for 10 weeks. All markers were determined at the start, week after week 10 and week 11. The metabolic panel and testosterone levels were looked at week 0 and week 11. Lean body mass increased in the keto and the diets at week 10. Keto showed lean body mass increase after week 10, so it was continuing. Fat mass decreased in both groups. Strength and power increased equally between the diets. And here's the takeaway. Total testosterone increased significantly in the ketogenic diet while insulin levels did not change. Testing keto diet on reduction of body weight without compromising performance in powerlifting and Olympic weightlifting athletes. Keto diet versus the usual diet. They tested at baseline 3 months and 6 months. Each diet for 3 months. The keto diet resulted in significant lower body mass, increase in lean body mass. The takeaway, simply, in powerlifting and Olympic lifting athletes were lighter and lifted just as heavy on a ketogenic diet. So you're in a low weight class lifting the same weight. Isn't that every lifter's dream, to be able to go into a lighter class, lift the same or more? The keto diet increases, as we said before, glutathione levels. It was a twofold increase in glutathione. It upregulates the protein level of glutamate cysteine ligase subunit. It reduces COA, an indicator of mitochondria stress, not just status. And the ketogenic diet also increases lipoic acid. The bottom line, the takeaway, the results demonstrated that the ketogenic diet upregulates glutathione biosynthesis, enhances mitochondria antioxidant status, and protects M plus DNA from oxidant-induced damage. Some of the benefits of ketosis for athletes: the preservation of glycogen stores from the ketogenic diet. But essentially, it does not allow endurance athletes to hit the wall. And it's very simple. They're not going to hit the wall because they're not feeding into the glycogen storage, which is 2,000 calories. This whole idea about carbs for a long marathon or a triathlon or an Ironman didn't make sense, because you're going to go blow past your storage, and that's why you have to drink and tank. So as long as you're keto adapted, you're now going to be able to burn on the fats that are stored, and you got a lot more fat energy stored than carbohydrate energy. Diets also, during training, provide more fat loss, which is important to the ratio of fat to muscle. So for those who are looking to improve exercise performance or meet weight goals, ketogenic diet's a great choice. And the keto also may be a good diet practice for athletes in the off season as they maintain their health while resting. So again, I'm a proponent, good read, The Art and Science of Low Carbohydrate Performance. Essentially, health components. Low carbohydrate diets are anti-inflammatory. They produce less oxidative stress during exercise, more rapid recovery between exercise sessions, less dependence on muscle glycogen, less need to reload with carbs during and after exercise. Takeaway is, by reducing oxidative stress and inflammation, gut and immune functions are better maintained. Just a little aside, great option for any kind of gut health, ketogenic diet. So exercise, while you're exercising, ketogenic diet allows protein sparing, because when you're keto adapted, the body improves its efficiency of protein utilization. Beta hydroxybutyrate ketones are associated with better maintenance and increase in branched chain amino acids, which are essential for proteins or essential for protein synthesis. Ketones can be burned in place of BCAAs. So also, you'll see the keto burn has some branched chain amino acids. It's really going to be a very versatile product that I'll recommend. Less fatigue when you're keto adapted, less accumulation of lactate or lactic acid when keto adapted. Besides fuel, remember, ketones are great to help repair neurons, and make sure you get as many ketones as you can, because they are a clean burning fuel. So keto adapted phenotype, interesting. Here you've got the fuel source and the fuel signaling. Let's just go through it all, and you'll see the end result is increased endurance performance with a keto adapted athlete, improved insulin sensitivity, improved power to weight, improved recovery, and improved metabolic health and longevity. How about the keto diet's impact on brain health? Well, interestingly enough, as I said before, I like the ketogenic diet because of these neurogenetic or neurodegenerative issues. Keto is an excellent choice. Ketone esters are cleared in the gut and absorbed in the gut, and then either enter circulation or undergo first pass metabolism in the liver. So let's take a good look. Here we've got triglycerides getting broken down into fatty acids being sent to the liver. The liver, through ketogenesis, makes all the ketone bodies. These ketone bodies allow for fuel into the brain. So let's get this straight. The gut communicates with the liver, which ultimately can communicate with the brain. Another branch of the gut to brain axis. My Dr. Rob's Ketone Super 5. Ketone bodies are neuroprotective antioxidants. They're a more efficient energy source than sugar. They increase mitochondrial efficacy and production. They help regulate neurotransmitters through the brain, and they trigger the expression of BDNF, brain-derived neurotrophic factors, which allow for brain neurogenesis. So the question is, can the brain use ketone bodies? Without question. They've shown to increase uptake of ketone bodies by the brain, both in animal and human studies. Peripheral infusion of ketones, prolonged fasting, and ketogenic diet. It is a misconception that the brain can only use glucose. It not only can use fat and ketones, it's a choice fuel. So keto diet and autism. Results indicate the consumption of ketogenic diet likely triggers, reductions in total gut microbiota counts and composition remodeling. The gut is implicated. The gut microbiota is implicated in autism in the mom and in the child. So this may explain the ability of the ketogenic diet to mitigate some of the neurological symptoms associated with autism. How about for all the chiropractors or manual therapists, the efficacy of a keto diet with chronic cluster headaches? These were drug resistance cluster headaches. They did a 3-month keto diet. They had 18 chronic cluster headache patients. 15 responded to the diet. 11 had full resolution. 4 had at least 50% reduction. That's just on a diet. That's not with treatments. So the conclusion was a 3-month ketogenic diet ameliorated clinical features of chronic cluster headaches. How about dietary supplements with ketones to mitigate migraine attacks? Migraines may involve energy deficits. Supplying ketones, once again, a more efficient fuel than glucose, may help mitigate this energy metabolism problem. Keto diet. After 16 weeks, mice had significant increase in blood flow, improved balance in the microbiota, increased process clearing any amyloid beta, Alzheimer's, everybody, and beneficial effects due to the inhibition of the mTOR pathway. mTOR, mechanistic target of rapamycin, shown to affect lifespan extension and health promotion. I see that we have some questions. We've got about we'll have 5 minutes at the end. I will answer all your questions. If we have to stay later, not a problem. I'm just at a part now where I really want to get to the supplementation to improve the ketosis. And from there, I'll evaluate the time and we'll go from there. But caffeine, ketones, brain energy. Caffeine administration with MCT oil leads to the convert of more of those MCTs to ketones. MCT oil becomes more ketogenic when you consume it with caffeine because it stimulates the beta oxidation of fats. Caffeine with ketones results in enhanced brain energy metabolism. Ketogenic diet for concussion, one of my favorite topics. Ketones are found to prevent neuronal cell death, helps ATP depletion, reactive oxygen species, production and inflammation. Ketone bodies are a great, I love the term alternate source. They're a good main source of energy for the brain. As you've seen before, they're a more efficient source than sugar, and they do trigger the expression of BDNF. So here are some supplements to help improve ketosis. This is a critical element. You saw for women, we've got to detox them. We've got that protocol. Rob will share that information with you post-webinar. Supplements to improve ketosis, improve insulin sensitivity and reduce inflammation, decrease the risk of chronic disease, and improve muscle development. Turmeric, a great choice. Turmeric results in blood glucose stabilization and lower triglyceride levels. Chromium also increases production and the release of glucose transport molecule called GLUT4 enzymes in liver and muscle. Chromium, the takeaway here is, it opens a window in the cell that allows glucose to flow down a concentration gradient into the cell where it can be metabolized for energy. Some others, acetyl L-carnitine, critical for fat metabolism and energy production in cellular mitochondria. Alpha-lipoic acid, unique and powerful antioxidant that has both water and fat-soluble properties. Omega-3 fatty acids. You want to eat and you want to take it just as a supplement because it's one of the best foods and supplements to stay in ketosis. It ensures an omega-3 to omega-6 ratio, natural anti-inflammatory, and contributes to keto diet high-fat intake requirement. So let's go through the supplements that I use for normal supplementation and adherence to a proper ketogenic diet. So the first one is Gluco-IR. It's an advanced nutritional support for optimum blood glucose levels. Gluco-IR is a high-quality vitamin and mineral supplement formulated with a proprietary blend of natural extracts and powders for optimum support in balancing healthy blood glucose levels already in normal range. It helps maintain blood glucose levels, and it provides antioxidant support. We all know glucose is the sugar naturally produced in the body after eating and converts to energy. The bottom line here is, so many people say, well, if I'm not eating carbs, what do I do? Well, guess what? So it's very hard to cut your carbs down. And the key component for burning fat to make ketone bodies is ensuring that you're not using your carbs. So you want optimum blood sugar regulation. Let me tell you something. Most people in your country and mine do not have optimum blood sugar levels. Here's a great choice. In addition, when you look at some of these ingredients, let's just hit a few. Berberine HCl. Berberine is great for blood glucose, fabulous for gut health. Alpha lipoic acid, not only good for blood sugar regulation, works with the watering in the fat part of the cell, also excellent for a multitude of systems. Green tea extract, great for immune health. So when you put this formulation, it's not only good for blood glucose balance, it's also good for overall health. I found it been a great addition to those on the ketogenic diet. And of course, curcumin. How can you not consider curcumin? Essentially, a curcumin that has 400 times the absorbability. Curcumin is great for immune function, great for joint pain, exercise-induced muscle soreness, antioxidant, helps with blood sugar regulation, keeping it in normal range, helps maintain blood normal range levels, assists in digestive function. Turmeric is a plant belonging to the ginger family. It gives curry dishes their distinctive spicy taste and golden color. The root of the plant has been used in traditional medicine throughout Asia for thousands of years, as it contains therapeutic compounds called curcuminoids. Curcuminoids, especially curcumin, act as powerful antioxidants in the body. A lot of research suggests that curcumin has ubiquitous roles in the body, affecting many vital processes. Curcumin has been shown to support healthy heart, immune, brain, joint, and digestive functions. What makes this curcumin 400 stand out is its feature is a preeminent form of curcumin BioCure. Essentially, the results indicate BioCure absorbs a 400% increase of absorbability. It's curcumin on steroids, if you will. Now, we talked about omega-3 fatty acids. Of course, why wouldn't you want the omega-3 fatty acids in your food? But clearly, it's easy to get it in a supplement, especially a liquid supplement. So this Omega Pure DHA 240, let's try that again. Omega Pure EPA DHA 2400 is an ultra potent and purified fish oil supplement containing evidence-based dosages of key omega-3 essential fatty acids and DHA in the most absorbable form, which is a triglyceride form. An extensive body of clinical research has demonstrated the efficacy of EPA and DHA for cardiovascular function, immune function, musculoskeletal support, cognitive functions, etc. So this is probably the most potent, clean form of omega-3s that I could recommend. So for me, the omega-3 fatty acids really come in as a supplement. They come in great because you can add them to any kind of shake that you're taking. And it's got the right caloric macronutrient breakdown to help you stay in ketosis. Exogenous ketones. Ketone salts, where beta-hydroxybutyrate is bound to a salt to improve absorption. 8 to 12 grams of beta-hydroxybutyrate, a great choice. Increasing circulating ketone levels for at least 1 hour. It gets you acutely into ketosis within 15 minutes. Here's the keto burn. One, what I love about the keto burn is it not only has got the sodium that's needed, it's got the beta-hydroxybutyrate. So 2 scoops, get you right where you need. It's got all the electrolytes in the branched chain amino acids. So dynamic keto burn contains bioavailable beta-hydroxybutyrate salts, which are designed to support nutritional ketosis. Being in a state of nutritional ketosis confers a multitude of therapeutic benefits, such as supporting energy production, blood sugar balance, insulin sensitivity, appetite, and actually a whole bunch more. Dynamic keto burn combines a precise blend of essential amino acids, L-citrulline, and beta-hydroxybutyrate salts to power your energy and mental acuity throughout the day. The final takeaway, dynamic keto burn is formulated with ingredients that support healthy body composition and longevity in a variety of ways. So keto burn is a critical element, as well as supplements to improve ketosis, which is MCT oil or powder. We recommend the MCT oil because you can take the keto burn, the MCT oil, and the omega-3s in a liquid, make a shake, and really have this Gothic colossal shake. MCT oil, body uses this for energy right away, shorter chain length and fatty acids, quicker pathway when metabolized, converts to ketones used for fuel, doesn't store as fat, and it's really beneficial on the keto diet. We talked about the MCT oil, so here's the one that I recommend. Cognitive support, supports healthy cardiovascular function. 1 tablespoon will do it. Easy to digest and really easy to add to that shake that we talked about. So my suggestion, somebody comes in and can't pop into ketosis, give them the salt, the MCT oil, and you're not going to hurt them with the omega-3s. That's also a great adjunct to serum, to adding when people come in with an acute concussion. So some of the benefits of fasting on the ketogenic diet, most interesting, I'll give you this, and I think we'll start getting closer to those questions. But the bottom line is, the takeaway here is getting into a state of ketosis faster with intermittent fasting, time restrictive eating helps you drop weight, mental acuity, improves health, enhances muscle growth, reduces inflammation, and improves insulin sensitivity. Fasting induces the release of beta-hydroxybutyrate. Beta-hydroxybutyrate, which you can take exogenously also in those keto burn, promotes division and multiplication of cells that line the inside of blood vessels, delayed vascular aging through endothelial cells. It actually helps prevent cellular aging, and it also keeps the DNA of the endothelial cells young and undamaged. Bottom line, you can take it and you can produce it. Beta-hydroxybutyrate is, as I said earlier, the gold medal winner. The effects of fasting and shaping gut microbiota, essentially a 16-hour fast, help the gut microbiota. Intermittent fasting, essentially in the gut microbiota, IF promoted white adipose sprouting, decreased obesity by changing gut microbiota, altered functions of the gut microbiota in fasting and fasting groups, inducing beige formation. White adipose tissue to brown adipose tissue transition, it's a tremendously beneficial reaction. Intermittent fasting benefits for gut health. All my patients, I put on some form of intermittent fasting. A couple of quick takeaways on IF or time restrictive eating. I'm a big proponent of having them eat breakfast. So my windows are 8 to 4, 8 to 6. As we all know, gut health matters. And the gut health matters is simply, very simply, 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. It enables you, this intermittent fasting, to work with your circadian rhythm, which plays a critical role in not only your gut health, but your overall health. What you'll find with this intermittent fasting and the ketogenic diet is you're giving your digestive system a needed break. Fasting, low carbs, enable your body to produce and work with your migrating motor complex, which is your peristaltic contractions of your stomach to your small to your large intestine to move the food bolus. It's a great way to improve your gut to brain health. The bottom line is intermittent fasting, time restrictive eating is wonderful. It is extraordinarily synergistic with all diets, but I think at the top of the list, it may be the ketogenic diet. So my question, are we ready for Monday morning? Rob and I were just talking about it. It looks like Q1, with the advent of COVID and COVID having all these re-exacerbations. We've added an immune chapter. We've added a gut to lung chapter. So the book has been, it's like we're on a third update. The book is robust with information. You guys will all love it. Rob will start to let everybody know when it's available. And I always I'd say 5 minutes for questions. I'm going to pop in there. And I see one question. And then Rob, if you mind popping on, I'll answer that question. It's a great one. How long do you recommend hormone balance for PCOS women? At least 3 months.
Rob, can I add in? Would you also add the myo-inositol complex to that as well?
Absolutely. Absolutely. It was a slight oversight on my part. And the reason I missed it was, again, in 60 minutes, we've gone over so many different protocols. I didn't want to give more, but I would strongly recommend exactly what you said. And let's take a second and really look at this, because we've got a few minutes, and I know we have a crowd that listens later on Memorex. The takeaway with the ketogenic diet, once again, big points: 75% fat, 20% protein, 5% carbohydrate. The goal is to use fat as energy, to be keto adapted and not carbohydrates. Clean keto versus dirty keto. All you're doing is not eating the processed food junk, eating a better brand of protein and fats, and truly avoiding dairy. And the only dairy you're really avoiding, instead of butter, it's clarified butter or ghee. Instead of cheese, use a vegan cheese. You do that. I have people coming in losing, obviously they're hefty, losing 10 pounds a month. So the keto diet's great. You want to mix it with the intermittent fasting. And the reason you want to mix it with the intermittent fasting is it's just been shown to be really synergistic. What I'll do is I have an article, a blog that I just wrote. I'll send it to you. You can attach it to the bottom so they can read how that goes together. As a matter of fact, there is I alluded to supplements. If you'd be so kind to add the protocol list at the bottom to that particular blog, I think that would lead people down a path of understanding the implementation. The women from 15 to 50, when their estrogen is a little higher, we've found out through different studies that they don't respond as well to ketogenic diet. Don't fret. Have them detox. It's because their estrogen levels are too high. And most women anyway have an estrogen detox problem. You're going to win on health. You're going to win on a ketogenic diet with the females with the dynamic hormone performance. Acne, energy levels, gut health are going to improve. You mix that with what Rob said, the dynamic performance, and the NutraChel X. Great combination to enable women not only to detox the estrogen pathways, but also more so make them more amenable to ketogenic diet. And last, I gave you a bunch of things to look at to supplement the ketogenic diet. MCT oil, omega-3s, and the keto burn are critical. Those are the first three things that you do when somebody comes in. 1, 2, 3. That's what I do. The blood sugars are a great option also with the gluco-IR and the curcumin X. Great choice. So you do those, you're going to see wholesale changes, and people be coming to you for the keto diet. Does the keto diet affect the thyroid? Yeah, there's a lot of rhetoric on bloggers and everything. I've seen no data to imply that. Now, let me say this. And maybe we have to do a thyroid webinar. I know Rob and I were talking about a women's health webinar. However, it does not affect, to my knowledge, the thyroid. And yeah, I see a yes, please on the woman. You got that one, Rob. It's going to blow up.
Yeah, we got that. We'll do that.
Yeah, it's going to blow up. But how does the keto diet affect it? I don't see that it does. I think the problem, and most people look past the thyroid, and they're not realizing that the thyroid's adversely affected by gut health and liver toxicity, because remember, the thyroid gland is attacked mostly from autoimmune components. And here's your takeaway of the day. Gluten and dairy affect the thyroid gland.
Fantastic. Yeah, and unfortunately, that's something that's not overly tested. The anti-thyroid antibodies are not tested routinely, unfortunately. Rob, just like to say a massive thank you for your time. Thank you for the information you shared. The slides and recordings will go out tomorrow. Our next webinar with Dr. Rob will be on the 19th of November. That'll be a great one on sports performance and endocrinology. And then we have the December one, which will also be fantastic, with case studies and how to implement nutrition into your practice. Again, thank you to everyone that's popped on today. Have a great day, and we'll see you soon.
Take care, all.